Hello, I'm Cindy Stull, Assistant Professor and Director of the Division of Dental Hygiene at the University of Minnesota. I'm the lead author on the June 2025 article titled Utilization of the HPV Brief Motivational Interviewing Skills-Based Training Among University of Minnesota Dental Hygiene Alumni. That's a mouthful. Did you know that despite the availability of a safe, effective cancer-preventing vaccine for nearly 2 decades now, HPV-related oropharyngeal cancer is now the #1 associated cancer, and it's outpacing even cervical cancer. In fact, there's about 59 cases of HPV-related oropharyngeal cancer that are diagnosed every day in the United States. Now, the good news is that while this incidence rate for oropharyngeal cancer is increasing, tobacco and alcohol-related oral cancer is declining. And I believe that part of the reason for this decline is the excellent job that all of you have been doing at tobacco cessation counseling with your patients. Now, as prevention specialists, dental hygienists are key providers in reducing HPV-related oropharyngeal cancer rates by educating your patients and by advocating for the vaccine. It's surprising, but after nearly 20 years, HPV vaccination rates still fall far below the national target rates. And when asked, the #1 reason people report they don't receive the vaccine is that they just didn't get a recommendation from their provider. And I think this is where you all really can make a difference. Since 2019, the University of Minnesota has been training our students to counsel their patients on HPV prevention using brief motivational interviewing, which is a patient-centered collaborative approach to behavior change counseling. And many of you may use MI for other purposes. Now, what we know from our research of this training is that using the brief MI communication improves students' comfort and confidence in having these really difficult conversations with patients on sensitive topics like HPV. You can find our research on this training program in our 3 articles that have been published in the Journal of Dental Hygiene in 2021 and 2022. But what we didn't know was, how is this knowledge and training being used in practice? Did it translate to clinical practice years later after students have graduated? So we surveyed alumni who had received the training to learn how they were using the skills they learned. Our findings are fascinating and point to the opportunities that we have as dental hygienists to increase vaccination rates for the prevention of oropharyngeal cancer. I would like to acknowledge my co-authors, Michelle Arnett, Kelly Rogers, Keely Flavin, Rachel Thielen, and Michael Evans. And I encourage all of you to read our article to learn more about this important research.